Welcome to this video on the potential of stem cell therapy for the treatment of anemia. Anemia is a condition that affects millions of people worldwide, and it occurs when the body does not produce enough red blood cells or the red blood cells are not functioning properly. Traditional treatments for anemia include blood transfusions and medications, but stem cell therapy offers a new and promising approach. In this video, we will explore the use of stem cell therapy for the treatment of anemia, including the use of hematopoietic stem cells, HSCs, the different sources of stem cells, and the potential benefits and limitations of this therapy. We will also discuss the factors that affect the success of stem cell transplantation for anemia, and the ongoing research aimed at developing safe and effective stem cell therapies for this condition. Whether you are a patient with anemia, a healthcare professional, or simply interested in the latest advances in medical research, this video will provide you with valuable insights into the potential of stem cell therapy for the treatment of anemia. So, sit back, relax, and join us on this journey into the fascinating world of stem cell therapy. 1. Anemia is a common blood disorder that occurs when there is a decrease in the number of red blood cells or a decrease in the amount of hemoglobin in the blood. Hemoglobin is a protein in red blood cells that carries oxygen to the body's tissues. When there are not enough red blood cells or hemoglobin in the blood, the body does not receive enough oxygen, which can lead to symptoms such as fatigue, weakness, and shortness of breath. Anemia can be caused by a variety of factors, including iron deficiency, vitamin deficiency, chronic diseases, and genetic disorders. 2. Stem cell therapy is a type of medical treatment that involves the use of stem cells to repair or replace damaged or diseased cells in the body. Stem cells are cells that have the ability to differentiate into different types of cells, including cells that make up various tissues and organs in the body. By transplanting stem cells into a patient's body, doctors and researchers hope to stimulate the growth of new cells and tissues, which can help to restore function and improve overall health. Stem cell therapy is being investigated for a wide range of medical conditions, including anemia, cancer, heart disease, and neurological disorders. 3. Stem cells have the unique ability to differentiate into various cell types, including red blood cells. The process of differentiation involves the transformation of stem cells into specific types of cells with specialized functions. Hematopoietic stem cells, HSCs, a type of stem cell found in the bone marrow and umbilical cord blood, can differentiate into all blood cell types, including red blood cells. When transplanted into a patient's body, these stem cells can generate new red blood cells, which can help to treat anemia and other blood disorders. This ability of stem cells to differentiate into various cell types is what makes them so valuable for medical research and treatment. 4. Hematopoietic stem cells, HSCs, are a type of stem cell found in the bone marrow and umbilical cord blood that can differentiate into all types of blood cells, including red blood cells, white blood cells, and platelets. These stem cells play a vital role in the production of new blood cells in the body, and they are constantly replenishing the supply of blood cells that are needed to maintain normal bodily functions. Because of their ability to differentiate into all blood cell types, HSCs are particularly valuable for the treatment of anemia and other blood disorders. When transplanted into a patient's body, HSCs can generate new red blood cells, which can help to restore normal blood cell function and alleviate symptoms of anemia. The use of HSCs in stem cell therapy for anemia is an area of active research, and there is growing interest in the potential of these cells to improve the lives of patients with this condition. 5. Hematopoietic stem cells, HSCs, can be obtained from several sources, including bone marrow, peripheral blood, and umbilical cord blood. Bone marrow is the traditional source of HSCs and has been used in stem cell transplants for several decades. HSCs can be collected from the bone marrow of a donor through a procedure called bone marrow aspiration, which involves extracting a small amount of bone marrow from the donor's hip bone. Peripheral blood stem cells, PBSCs, are another source of HSCs that can be collected from a donor's bloodstream using a process called apheresis. Apheresis involves removing blood from the donor's body, separating out the HSCs, and returning the remaining blood components back to the donor. Umbilical cord blood is a rich source of HSCs and can be collected after the birth of a baby. The blood is extracted from the umbilical cord and placenta and stored in a cord blood bank for future use. The source of HSCs used in stem cell therapy depends on the specific condition being treated, as well as other factors such as the age and health of the donor and the availability of a suitable donor match. 6. There is a growing body of research that suggests that hematopoietic stem cell, HSC, transplantation can be an effective treatment for anemia and other blood disorders. Studies have shown that HSC transplantation can help to improve the symptoms of anemia, such as fatigue and shortness of breath, and increase the production of red blood cells in the body. In some cases, HSC transplantation may be used as a curative treatment for anemia. For example, in patients with sickle cell anemia or thalassemia, HSC transplantation can replace the defective blood cells with healthy ones, which can help to alleviate symptoms and improve overall health. In other cases, HSC transplantation may be used as a supportive therapy to help manage the symptoms of anemia and improve quality of life. Overall, the use of HSCs in stem cell therapy for anemia is an area of active research, and there is growing interest in the potential of these cells to improve the lives of patients with this condition. While more research is needed to fully understand the benefits and limitations of HSC transplantation for anemia, the results of current studies are promising and suggest that this approach may be a valuable treatment option for some patients. 7. Hematopoietic stem cell, HSC, transplantation is typically reserved for severe cases of anemia, such as those caused by genetic disorders like sickle cell anemia or thalassemia, or as a complication of chemotherapy or radiation therapy for cancer. In patients with severe forms of these conditions, HSC transplantation can replace the defective or damaged blood cells with healthy ones, potentially curing the disease and alleviating symptoms. However, HSC transplantation is a complex procedure and is associated with some risks, including the possibility of rejection or graft versus host disease, in which the transplanted cells attack the recipient's body. For these reasons, HSC transplantation is typically only recommended for patients with severe, life-threatening anemia or those who have exhausted other treatment options. In less severe cases of anemia, other treatments, such as iron supplements or erythropoietin-stimulating agents, may be used to help manage symptoms and increase red blood cell production. 8. The success of hematopoietic stem cell, HSC, transplantation for anemia depends on several factors, including the age and health of the patient. Younger patients with fewer health complications generally have better outcomes with HSC transplantation. The source and quality of the stem cells. HSCs obtained from a well-matched donor or from a patient's own cells, autologous transplantation, have a higher chance of success. The quality of the HSCs and the number of cells transplanted are also important factors. The type and severity of the anemia. Certain types of anemia, such as sickle cell anemia, thalassemia, and aplastic anemia, have a higher chance of success with HSC transplantation. The severity of the anemia can also affect the success rate. The type of transplantation. Different types of HSC transplantation, such as allogeneic or autologous transplantation, may be used depending on the patient's specific condition and medical history. The management of complications. HSC transplantation can be associated with several complications, such as graft versus host disease, infections, and organ damage. The success of the procedure also depends on the ability to manage and treat these complications effectively. Overall, the success of HSC transplantation for anemia depends on careful patient selection, appropriate matching of donor and recipient, and careful management of potential complications. The success rate of HSC transplantation for anemia varies depending on these factors, but it is generally higher for patients with severe forms of the disease who are otherwise healthy. 9. Induced pluripotent stem cells, iPSCs, are a type of stem cell that can be generated from adult cells, such as skin cells, by reprogramming them to a pluripotent state. Like HSCs, iPSCs have the ability to differentiate into all blood cell types, including red blood cells. Researchers are exploring the use of iPSCs as a potential source of HSCs for transplantation because they offer several advantages over other sources of HSCs. iPSCs can be generated from the patient's own cells, which eliminates the need for donor matching and reduces the risk of rejection. iPSCs can also be generated in large quantities and can be genetically modified to correct genetic defects before transplantation. However, there are still several challenges that need to be overcome before iPSC-derived HSCs can be used clinically. For example, the differentiation of iPSCs into HSCs is a complex and inefficient process that requires further optimization. There is also a risk of genetic abnormalities or mutations during the reprogramming process, which could lead to cancer or other diseases. Despite these challenges, the use of iPSCs as a potential source of HSCs for transplantation is an active area of research, and many scientists are optimistic about their potential. If successful, iPSC-derived HSC transplantation could offer a new treatment option for patients with anemia and other blood disorders. 10. Although hematopoietic stem cell, HSC, transplantation shows promise as a treatment for anemia, further research is needed to fully understand its potential and to develop safe and effective therapies. There are still many challenges that need to be addressed, such as improving the efficiency and safety of the HSC transplantation procedure, developing new sources of HSCs, and managing potential complications. Additionally, there is a need for more clinical trials to evaluate the long-term safety and efficacy of HSC transplantation for anemia. Moreover, research on induced pluripotent stem cells, iPSCs, as a potential source of HSCs is still in its early stages, and further studies are needed to optimize the differentiation of iPSCs into HSCs and to assess their safety and efficacy for transplantation. In conclusion, while stem cell therapy shows promise for the treatment of anemia, further research is necessary to fully realize its potential as a safe and effective treatment option. However, the progress made in this field so far is encouraging, and it is hoped that continued research will lead to new and improved therapies for patients with anemia and other blood disorders. In conclusion, stem cell therapy offers a promising approach to treating anemia, and research in this field is ongoing. While there are still challenges to be overcome, including the safety and effectiveness of stem cell therapies, the potential benefits are clear. We hope that this video has been informative and helpful in providing an overview of the current state of stem cell therapy for anemia. If you have any questions or comments, please feel free to leave them in the comments section below. Thank you for watching, and be sure to subscribe to our channel for more videos on the latest developments in medical research and healthcare.